Hey everyone, welcome back to our channel. Today we're tackling a health topic that's often overlooked but incredibly important. What if I told you that a persistent sore throat or a slight change in your voice could be signs of something much more serious? Yes, we're talking about throat cancer. What exactly is it? How does it start? What symptoms should you never ignore? And most importantly, how can you protect yourself? Stick around, because we're uncovering all the crucial details right here. If you found this video helpful, please give it a thumbs up and subscribe for more health-related content. What is throat cancer? Throat cancer is a general term for cancers that affect parts of your throat. Most commonly, it impacts the larynx or voice box and the oropharynx, which is the middle part of your throat. The larynx is crucial for speaking and breathing, while the oropharynx is essential for swallowing. Common types and statistics. There are several types of throat cancer, but the two most common are laryngeal and oropharyngeal cancer. In 2022, around 54,000 people were expected to be diagnosed with oropharyngeal cancer and about 12,000 with laryngeal cancer. For perspective, nearly 290,560 people were expected to be diagnosed with breast cancer in the same year. Symptoms of throat cancer. Throat cancer can present various symptoms, which can affect different parts of your throat. Here are some common signs to watch out for. One of the key symptoms to be aware of is a sore throat that lasts more than 2 weeks. But what does this actually mean, and why is it a red flag? A sore throat is common, especially with colds or the flu, and it typically goes away within a week or so. However, if you have a sore throat that persists for more than 2 weeks, it could be a sign of something more serious, like throat cancer. Here's why. Persistent soreness may indicate that there's a continuous irritation or abnormal growth in the throat. Cancerous cells can cause inflammation and pain that doesn't resolve on its own. If you experience this symptom, it's essential to see a healthcare provider for a thorough examination. Early detection can make a significant difference in treatment outcomes. Remember, it's always better to be safe and get checked out if you have a sore throat that lingers longer than usual. Another critical symptom to watch for is pain or difficulty swallowing, also known as dysphagia. Let's break down why this happens and what it could mean. When you swallow, numerous muscles and nerves work together to move food from your mouth to your stomach. If you have pain or difficulty swallowing, it could indicate a problem in the throat or esophagus. In the context of throat cancer, a tumor might be obstructing the normal pathway, making it painful or difficult for food and liquids to pass through. This obstruction can cause a sensation of food being stuck or a burning feeling during swallowing. This symptom shouldn't be ignored, especially if it persists or worsens over time. Difficulty swallowing can significantly impact your ability to eat and drink, affecting your overall health and nutrition. If you're experiencing this symptom, it's crucial to consult a healthcare provider to determine the cause and receive appropriate treatment. One of the most important symptoms to be aware of is hoarseness or changes in your voice that last for more than 2 weeks. Let's dive into why this could be a warning sign. Your voice is produced when air passes through your vocal cords in the larynx, causing them to vibrate. If there's a persistent change in your voice, such as hoarseness, it can indicate an issue with your vocal cords or the surrounding areas. In the case of throat cancer, a tumor can form on or near the vocal cords, disrupting their normal function. This can lead to a raspy, strained, or hoarse voice. Unlike temporary hoarseness caused by a cold or overuse, which typically resolves within a few days, voice changes from throat cancer persist and do not improve over time. If you notice any persistent changes in your voice lasting more than 2 weeks, it's crucial to see a healthcare provider. Early diagnosis can lead to more effective treatment and a better outcome. Remember, your voice is a powerful indicator of your health, so don't ignore these changes. Another dangerous symptom to be vigilant about is the presence of lumps in the throat or mouth. Let's explore why this could be significant. Lumps in these areas can be felt as unusual growths or masses, which might be painless or cause discomfort. These lumps are concerning because they could indicate the presence of a tumor. In throat cancer, cancerous cells can form a mass that grows over time, leading to noticeable lumps. These lumps can appear in various locations, such as the back of the throat, the roof of the mouth, the tonsils, or the tongue. They might cause difficulty with swallowing, a feeling that something is stuck in your throat, or even pain. It's important to remember that not all lumps are cancerous. However, if you discover any new or persistent lumps in your throat or mouth, it's essential to consult a healthcare provider. Early evaluation and diagnosis can lead to more effective treatment options. Being proactive about unusual lumps can make a significant difference in managing your health, so don't hesitate to get them checked out. Most critical symptom to watch for is the presence of lumps in the neck, including the back of the neck. Let's talk about why this can be a warning sign. Lumps in these areas can be an indication of swollen lymph nodes, which often occur when the body is fighting an infection. However, persistent or unexplained lumps can sometimes signal something more serious, such as throat cancer. In the case of throat cancer, cancerous cells can spread to the lymph nodes in the neck, causing them to enlarge. These lumps may be painless or tender to the touch and can vary in size. Unlike lumps caused by minor infections, which typically resolve on their own, lumps associated with cancer do not go away and may continue to grow over time. If you notice any new, persistent, or enlarging lumps in your neck, especially if they last for more than 2 weeks, it's essential to seek medical attention. Early detection is key in effectively treating throat cancer and preventing its spread. Don't ignore these signs. Getting them evaluated by a healthcare provider can lead to a timely diagnosis and better treatment outcomes. Ear pain that persists for more than 2 weeks is also a key symptom. This might seem unrelated to throat cancer at first, but let's break down why it's important. The ear and throat are connected through a network of nerves. When there's a tumor in the throat, it can press on these nerves or cause referred pain, which is pain felt in a different location from the actual problem. This referred pain can manifest as persistent ear pain, even if there's no visible issue with the ear itself. In throat cancer, this symptom often occurs without other common ear issues like infection or fluid buildup. Persistent ear pain, especially in one ear and without any apparent cause, should raise a red flag. If you experience ear pain that lasts more than 2 weeks, it's crucial to see a healthcare provider. They can conduct a thorough examination to determine if the pain is related to a more serious underlying condition, like throat cancer. Early detection and intervention can significantly improve treatment outcomes. Remember, persistent ear pain isn't something to ignore, especially if it's out of the ordinary for you. It's important to note that having these symptoms doesn't necessarily mean you have throat cancer, but if they persist for 2 weeks or more, you should see a healthcare provider. Throat cancer starts when something triggers changes in the genetic makeup of cells in your throat, turning healthy cells into cancerous ones. While the exact cause is still under investigation, several risk factors have been identified. Tobacco use, including smoking and chewing tobacco. Heavy alcohol consumption. Human papillomavirus HPV infection, HPV and throat cancer. Speaking of HPV, certain types can cause oropharyngeal cancer. Around 1% of men and women have the HPV infection that leads to throat cancer. Most adults are exposed to HPV at some point, but some people's bodies can't fully clear the virus, increasing their risk of developing cancer. If you found this video helpful, please give it a thumbs up and subscribe for more health-related content.